I'm very concerned that the successful implementation of the mental health strategy might be at risk without the sustained additional investment that we need. It's important to note that the process of implementation of the strategy has already started. Many of the actions are being progressed right now, and we need to see the whole process through for the full 10 years so that we can create a mental health service that can meet the needs of the population, so that people who are struggling with their mental health can get the help that they need. There's been good progress to date. We have perinatal mental health services in each trust. We've completed the groundwork for the regional mental health service and the regional crisis intervention service, and we're about to see the workforce plan. Of course, the next stage is to commission training places because we've just so many vacancies across mental health services right now, and that's stifling progress too. We can't afford to lose the momentum, and we need to build on the work that's already undertaken so that we can get this right. Sustained investment would create better services for people who require psychological services and more accessible specialist services, such as services for people with eating disorders or personality disorders, and of course expanded child and adolescent mental health services. The strategy itself has been approved by a minister. However, we do need an executive in place so that the additional funding can be allocated so that we can continue to implement the strategy. I met with the Permanent Secretary for Health, and I wrote again on Mental Health Awareness Week to highlight the need for this funding for the strategy and also the impact of the cuts that we're seeing across the different government departments that those cuts will have on mental health of our population. I also met with the Secretary of State, Chris Heaton-Harris, and again he made it clear that he wasn't able to allocate that funding, that we needed ministerial approval to get the funding released. It is just devastating to think that 1 in 5 adults and 1 in 8 children here have poor mental health, and it also costs $3.4 billion annually. It's one of the reasons for the disproportionately high levels of economic inactivity here too. If we could implement this strategy in full, we'd certainly reduce the high levels of suffering and trauma that's now passed from one generation to the next. And of course, we would all be so much better off economically. So it's really an investment that we must make.